General surgery is broad-based, primarily operations in the abdomen, hernias, gallbladders, colon resection, stomach surgery. We have a department of surgery that is 6 people strong. Each of us have our own niche of procedures and skill sets and talents that we individually divide the cases up based on what the problems are. The Da Vinci robot system has been available for a few years. I saw the benefit for my patients with hernia repair. Some of the complex abdominal wall reconstructions that we were doing, the robot really decreases the length of stay, decreases the pain. I think the outcomes and the complication rates have decreased. Prior to the robot, the typical complex hernia reconstruction of the abdominal wall, people would be in the hospital 3, 4, or 5 days. It went from that to implementation of the robot. 8 out of 10 now are done as an outpatient, and the other 20% stay 1 to 2 days. There are multiple different surgical techniques for hernia repair. And each individual surgeon has skill sets and toolkits and procedures, and they have to match. You know, I would not use the robot in every hernia repair. It's just not indicated, not needed. But on occasion, it is needed. And at the end of the day, it's what's best for the patient. I get a lot of enjoyment out of weight loss surgery because I see a true transformation of people's health. You know, I cure diabetes with the, weight loss. Their hypertension gets better. They're able to be more mobile. It's a good operation with not a lot of problems and complications. 20 years ago, I had a choice where to go and practice. When I got done with residency, my first choice was here. It's home. The King's Daughters is a wonderful organization, and it's even better now than it was 20 years ago. You have a colorectal surgeon now that adds procedures that traditionally we would have to refer to Lexington or Ohio State. Here at King's Daughters, we send out very few people now. Most of the things that need to be done in our community can be taken care of here.